Well, aloha and good morning. Happy Monday to all of you. And thank you so much for joining me and Ryan Kalei-Suji. I'm Yenji Denise. We are here on Spotlight Hawaii, a program we bring you Monday, Wednesday, and Fridays, talking to newsmakers and influencers here in the state of Hawaii. We are focused today on the vaccine rollout. And Ryan, today we have the person who is in charge of that.
That's right, someone who has joined our conversations many times over the past few months. We have joining us from the state capitol, Lieutenant Governor Josh Green. Good morning, Lieutenant Governor. Thanks so much for joining us this morning.
Good morning.
We want to first start off, before we get to the vaccine rollout, just the overall numbers. We've been seeing within the past week or so a surge in the case numbers throughout the state, not only here on the Oahu, but also on the neighbor islands. What are your thoughts about these rising numbers and your concerns as we continue to move forward through this pandemic?
So I share that concern. Today's count is 172. The 7-day average for the state is 189 per day. The positivity rate stayed very low, 3.3%. So we're doing okay. This is still the remnant of the surge from New Year's, where social gatherings, that is, caused a surge of consequence. And it's almost all been from those social gatherings, whether it's an office party or a gathering at home with 10 people, loving friends, but friends from different bubbles. And so we get spread that way. That's where most of the spread's been. I do believe that it's beginning to come down. We had a day of 300, then 265, then 250, then 200, and then 172. So it's pretty clear what that trend has been. Now we do have 2,268 active cases, which is higher by about 800 at least, maybe 900 than we were settled with before, in between the December 1 date and then today here on the 11th of January. So that's been of consequence. We're at 106 people in the hospital today. I get those updates every morning before 9 a.m. from all the CEOs and their designees. So we're doing fine there. It's been very steady for the last 5 days, though higher than it was, 6 weeks to 8 weeks ago, when it was closer to 55 to 60 in the hospital. But we are doing fine. We've kept our mortality rate low, and lowest in the country, in fact. So it would be great to get back down just to double digits. I expect we can get there sometime around maybe the 20th of January, once we've seen all of the holiday surge clear out.
Diana from Maui says, this may have been asked, but interested to know if there's a chance for a lockdown in the near future. What are you looking at when you start to make that determination? And is that something that is a possibility?
Well, that determination is made in a different way than the Lieutenant Governor asking for it. I asked definitely for a very clear pause on social gatherings, but not any lockdowns. That's up to the mayors. The mayors have to look at their tiers and make a determination whether or not the spread is out of control and whether they can manage it in their counties. There has been more in the way of COVID cases on Maui for sure. There was a little bit more on Kauai, even though nothing has changed. There's just some community spread that's been going on. Big Island has settled down quite a lot, and Oahu's number is actually pretty modest. It's 108 when you think that, of course, there's 1 million people that live here. So very low number as compared to any other geographic place in the country. The mayors are going to continue to weigh in. We send a heartfelt prayer out to Mayor Roth, who is going through a little bit of a health challenge right now. He's going to be fine. He spoke with me yesterday. He and his team are on top of things, and he's just a great human being. So he'll be okay, and they'll be addressing this too. So each mayor has to recommend to the governor, usually on they have an 11:15 call with the gov and me Monday, Wednesday, and then they're themselves on Friday. So they're in constant communication, and if they get concerned, they make recommendations. I don't see a lockdown on the near horizon, though.
I want to ask about sort of the changing of the guard for the city and county of Honolulu with a new mayor in place. We haven't necessarily heard much from Rick Blangiardi in terms of his preference for the tier system. We have heard that he's saying that Oahu will maintain and stay in this tier 2 system. Would you agree with that? Do you think that at some point in time, Oahu should shift back down to the tier 1 system based on the numbers that we've seen? And if this average stays above 100, that would, under the old system or the Caldwell system, would have taken us down to tier 1.
Well, you know that Mayor Blangiardi, who I'm very fond of, is a very shy, shrinking violet, right? He's very quiet, doesn't like to blast out. So I'm teasing. Of course, Rick's an outspoken guy. He's very strong. He's very thoughtful. I think what he's doing is he's taking a close look. He and I spend a lot of time talking about these things, a close look at where his numbers are, what the impact of the economic lockdown has been and whether he feels he can control the spread. So I leave that totally to him. I think it would be not fair of me to recommend anything on behalf of the city and county of Honolulu, especially when the mayor's in his first 2 weeks. But he's looking at the analytics. We give him those updates really regularly. I'm in constant communication with him on both the numbers that are just raw numbers of cases and the hospital cases, because most of the hospital cases are right here in Honolulu. I can tell you that the three highest number of admission rates are right here in Honolulu for the main hospitals, Queens, Hawaii Pacific Health, and of course Mauna Loa. So these things all factor into it. I don't think we're going, personally, this is me saying it, I don't think we're going back to tier one. I think as long as we keep the lid on social gatherings, now that we're well out of January 1, the numbers will gradually come down. And we're approaching a time when 1 million travelers have come to Hawaii after Safe Travels has begun and has not gotten out of control as far as travel-related cases. So he's trying to be cautious is what I would say. But it would be more fair for him to speak to you on this show or in whatever other venues he sees as the best place.
Let's move on to the vaccine. Let's start with sort of the big picture. How are we doing in terms of the rollout? How many doses have we gotten? And are the vaccine trays, if you will, are they arriving as predicted on schedule? I know one of the challenges, of course, is that on Thursday we find out what we're getting, and so it's kind of hard to plan. But are we getting it at the sort of anticipated clip?
That's a great question. So we've vaccinated as of now, or the latest number I got, which was earlier this morning, 38,987 individuals. Now you're seeing a couple things happen. Some people are getting vaccinated if they're in the 1A category, that's healthcare workers and kupuna at nursing facilities. Excuse me, those individuals are getting their second shot, and lots of individuals are getting their first shot. And I'll break that down a little bit for you. So remember, there's 3 weeks in between vaccinations for Pfizer and 4 weeks in between vaccinations for the Moderna shot. So we've had a lot of vaccines starting to come in. We had expected 150,000 doses per month. I think it's going to look a little bit more like 100,000 doses that come in January. So an easy calculus on that is that 50,000 individuals can be fully vaccinated if you get 100,000 doses. And it's going to ramp up to at least 150,000 doses per month in February and so on. Also, we're anticipating, just so you know, 2 new companies being approved by the United States. That would be Johnson & Johnson and AstraZeneca, those 2 companies. That could double the amount of vaccine we start getting come March. So if that happens, we move toward 300,000 vaccinations that are kind of in the works. Right now, 150,000 doses. We move up to 300,000. That's 75,000 per increment. It gets real confusing, I know, because there's so many companies and so many numbers, but it will accelerate how fast we get to just regular people who don't have any high risk or aren't obviously our kupuna. This first month and a half, January and February, we're hopeful to get through all of 1A and 1B. That's 200,000 people. And you're going to see a lot of big changes coming in about 7 days, because we will be launching some of the more robust pods here in Honolulu. It's going to be announced more formally on Friday, but I can tell you we've reached agreements in principle to work with our great partners, Hawaii Pacific Health and Queens. It looks as though Hawaii Pacific Health will man the place that's Pier 2, and they'll be doing kupuna and our critical infrastructure folks and so on. That will likely start next Monday as they work through the details. We'll get you final information in the next couple days. And then a week later, it looks like Queens will take up the task over at the Blaisdell concert area. And there's a lot of logistical stuff that has to get done between now and then. But that means we can start doing thousands and thousands of our kupuna and our essential workers. This is the time where, when we lock all of those vaccinations in, we do have enough supply for that, we can really make it safe for our most vulnerable population. Then we move to the next phase, 1C, which is people 65 and older, and also those individuals that are still essential workers that weren't as front-facing, and people with chronic disease, which is a really large number. So you can see how this kind of rolls out as a wave, and the wave has more than just one crest because lots of partners.
Lieutenant Governor, we're seeing across the country just the response to the vaccine rollout. Many in the other states, officials being critical of the Trump administration about how this rollout has happened. And we've also seen these long lines of senior citizens and kupuna waiting to get their vaccination shots, some saying that they sleep overnight and wait for hours just to get in line to get their vaccine. How do we do something here in Hawaii? What is the state maybe doing to make sure that we don't see those types of things where we're not having people waiting for hours with these large numbers of people maybe gathering in these distribution centers for the vaccine? How is that sort of being managed to avoid anything like that?
We're doing scheduling. So we're using a program called Acuity Scheduling. It's really quite easy. We send out emails and you're going to see a blitz of information to our kupuna from the health plans, HMSA, Kaiser, and so on in the coming days, plus from AARP. But basically you receive an email and it just has a link on it that says, click here if you want to go into one of the vaccination centers. And then it shows you times. It's got the address there. You put your name. I've done this a few times to just demonstrate it with some of our kupuna. You put a person's name in there. You put their age, in other words, their birthday, so they qualify. A little bit of minimal ethnic information, so we know some of the ethnicities and sex of the individual. And then they just click on the time and date that they'd like to go. And if it's available, it's clickable. And then that sends them an email. And then they're scheduled. And they just go. And they can get reminders. Our goal is to do that because even though it won't be perfect, we've been doing this very efficiently already over Windward at the Behavioral Health Center. Eddie Mercer has done a great job on behalf of Director Char. They're doing already 1,000 returns today and tomorrow with this system, with this Acuity scheduling system. And then on Thursday and Friday, they'll be doing kupuna and some other essential workers, again, with that same system. And I'll tell you, I went and volunteered and there was no line at all. People just came smoothly through. It'll probably be a little bit more, I don't want to say chaotic, but a little bit more busy when we have thousands of people coming to sites, but that's why we're picking larger sites where people can either drive through or park and do it. So I think the scheduling plan is much better. It may adjust over time, I guess I would say. It's possible that we'll find some hours that are going to be for walk-ins, we'll see. But in general, we don't want really long lines because long lines mean people are usually not socially distanced, and the very thing we're trying to avoid, which is avoiding transmission of COVID, could occur at the site. So far, knock wood, so good. They're doing now at least 500 people a day at these smaller pods. And so when we get up and running with like Blaisdell, for instance, I assume there'll be 5, 6, 7 times that size every day.
There are a few questions here. Doris has one that echoes the one from Michael above, which says, my very, very elderly parents don't have email. Will this be mailed to them? Can they access this information through their doctor? So what about some of our kupuna who, or, even other people in different tiers who don't have access to the technology that they might need to sign up online?
Yes, so there will be invitations. I don't know if it'll be by regular mail, but they will have extra information given to their doctors so that they can begin to reach out also. Obviously, people are only going to get the vaccination, one cycle. They're not hopefully going to repeatedly go to sites. We have to be careful not to confuse people because not all vaccinations are as straightforward as this one. We will also allow for some sign up at the sites, the facilities. One of the, I don't want to say sticking points, was that we wanted to have facilities, these big facilities that had very good Wi-Fi. And so there is some additional infrastructure being put into Pier 2 and to the Blaisdell, just because if you have good Wi-Fi, then we can have an iPad with some of our volunteers just typing people's information in. So that may very well be necessary. We'll probably rely on people's children and grandchildren to help sign them up. I think that's a reasonable expectation. It'll be fine for those people to put in their own email to get the reminder, but it's important that we do track information pretty well because we have to do good follow-up. The first shot is only good for about 52 to 55% immunity. The second shot gets you to that 95% immunity level, and we don't want people to forget or not come for their second shot. So a lot more work is put into the first shot rather than the follow-up shot. The follow-up shot's very easy. People show up, they recheck in. Hi, I'm Josh. I was vaccinated a few weeks ago. That's it. And off you go. So It's going to be a big effort. We are doing PSAs so that our kupuna can see it on TV, not just on, on an email. We're also going to be, of course, on the news quite a lot. And over time, it will get simpler and simpler, because as we roll out more and more vaccine, then it will ultimately be in the pharmacies. And people will go to their CVS or their Walgreens. They'll have to, they'll still have to give their information, but it won't be long lines, hopefully, because it'll be spread out very widely. And the neighbor islands, I don't want to forget my own roots. The neighbor islands are going to be leaning heavily on the community health centers and the hospitals. And so those folks are going to have a lot of extra information to share too. But the Coconut Wireless works differently on the neighbor islands, actually. So when it's an alert that someone's got 975 vaccines in a tray, everybody knows about it in like 15 minutes. It's amazing. So we'll be doing that too. Everyone's networks are going to be important. But like I said earlier, if you're looking at the big picture, this month and February should be pretty much the time to take care of the 1B and 1A categories. Then it goes much broader in March, April, May. And that population, the March, April, May population, I really don't want to be disrespectful to my elders and our kupuna, but that is the younger population who has a much easier time, with iPhones and Galaxies and iPads and constantly online. So I think that'll be easier to communicate then for the 1C category.
What are your thoughts on just the willingness of the general public to get this vaccine rollout? We know that there needs to be a certain percentage in order for there to be herd immunity within our own community. And we are hearing some cases of on the mainland where there is a lot of hesitation still, some by healthcare workers who are saying that they are hesitant to get the vaccine. What are your overall thoughts, and how will you be trying to address this concern that people have about any possible side effects or any hesitation at all to get the vaccine in general?
Sure. So that's a really interesting question. The couple things. First of all, we did poll this and did a big sample of like 4,000 people. So it was a very good poll. The poll showed that 59% of all of Hawaii wants to get the vaccine right away. And then another 21% are willing to be convinced to get the vaccine once some time has passed. And they break it down into a lot of ethnicities. It does vary some, okay? So it looks like up to 80% of our state seems either utterly willing, 59% of them, or the other 21%, if things go well and it's available and they haven't heard bad stories from people, they'll get vaccinated too. The last 20% probably won't get vaccinated. They're just more likely philosophically opposed, and that's okay. So that's the first part. Now, how do we address this? Well, one way is just for people to see doctors like me or nurses or their kupuna get vaccinated and realize it was good and it was helpful and there weren't any side effects. We have not had much in the way of side effects, mostly arm pain, then some muscle aches and feelings of kind of like a low-grade fever. That's what we've mostly seen. I'm, for instance, giving a talk, I think it's tomorrow, to one of our main hospitals, talking to our hospital staff, because we've heard that about 20% also of the healthcare community themselves just don't want to be vaccinated. Once again, it's people's own prerogative. This is a voluntary vaccination. I will say this, though, if you're a healthcare worker and you're going to continue to see patients and you don't get vaccinated, it's not just you who you're putting at risk, it could be others. The one thing that we also found from the poll was that people's number one reason to get vaccinated was to protect the ones that they love, interestingly. They were less concerned about themselves by a large margin, and they were more concerned about catching COVID and then going home and spreading it to either their parents or grandparents. So there's lots of reasons that people have to choose to get a vaccine. There are going to be a lot of young people that are thinking, well, why should I bother? I know it's free, but it's not going to hurt me anyway. They now know that it could, have a very severe impact on their parents or grandparents. So there's another reason there to get vaccinated.
There are some questions here about specific populations, the homeless, and also the prisons. We've seen, of course, these huge clusters in the prisons. Are those folks being, sort of accelerated on the track regardless of age, given that they live together in close living conditions, and we've seen these big outbreaks? Let's start with the prisons, and then if you have anything on the homeless as well.
Neither group is formally in the 1B category. The 1B category was reserved almost exclusively for kupuna and critical infrastructure individuals. However, in the committee, which we had a very potent group of the leading physicians across the state, physicians and nurses mostly. We did give the full prerogative and advice to the director for any hotspots or areas of additional concern. So that would include a prison or a nursing home that hadn't been gotten to yet, or a homeless shelter. If there's been a kind of an explosion of COVID there, the answer is yes. Or even a subset of our community where, say, in a part of the Pacific Islander community, or in a place where people were living with a lot of individuals in multi-generational households where there's been spread, that the director can go in there and kind of put out a fire. So Director Char may ask us to go and vaccinate 500 or 1,000 people at a housing complex, like you saw on Maui, where there was an outbreak after the choir practice, or yes, a nursing home, or even the prison. If the prison outbreak continues, and we've been emphasizing getting all of our guards vaccinated first, what's been going on is the guards were taking care of individuals in the prison, it got to the prisons, and then it would spread back and forth between the guards and the prisoners. So we really wanted the state personnel to get vaccinated right away because we didn't want them to spread it anymore. But the prisoners are vulnerable, and they always end up in the hospital too, or they often end up in the hospital because they can get sick like anybody else, and then it impacts everybody. Long way to say, closed institutional living is risky. And so we've been expediting not even just long-term care, but also assisted living where there's been small outbreaks.
I want to ask a question from Sam here. Once vaccinated, will you be exempt from quarantine after traveling? How will this vaccination program, not only here in Hawaii, but throughout the country and world, how will that impact the Safe Travels program moving forward?
My personal request is that if a person finishes the vaccination process, that they are then exempt from having any travel requirements. I did call the deputy director of the CDC the other day and asked that person very directly, do we have the evidence yet to show that you cannot carry the virus in your upper airways, your nose, your throat, and so on, if you've been vaccinated? And they don't have that data yet. They're doing a 90-day study right now to assess for that. So what they're doing is they're taking people who have finished the vaccination, and then they're swabbing them a couple weeks out, another couple weeks out, just to see if they find virus on them, basically. It's my expectation that people are going to be much safer. They would essentially be asymptomatic carriers in that case. And then if they coughed on someone or breathed on them, or there wasn't social distancing, they'd be putting other people at risk. I think we should suffice it to say that the vaccine has to be viewed as the key to opening up the world again. And so it will decrease spread very dramatically, because you wouldn't be able to give it to somebody who was vaccinated from a traveler that was carrying it. But they haven't given us a final answer. It might take a little bit longer than February 1st, as I've asked, but I do think that at the very least, I'm asking the governor to allow people to do inter-island travel, to not have to do the Safe Travels program for inter-island travel if they've been vaccinated. And I hope that will be also a nice, not just a good thing from a health standpoint, but a positive incentive for people to choose to get the vaccine, because it's less hassle to be traveling. And I think that people who have made a commitment to getting vaccinated, it's perfectly optional. We should recognize that they are less likely to spread this disease overall.
I want to get back to the vaccine in a minute, but since we are talking about safe travels, Speaker Psyche was on here last week, and he mentioned that one of the things that he's looking at is introducing legislation that would basically have the ledge take over safe travels, rather than having the governor sort of issue the mandates by emergency decree, and basically create a one system for all the islands, no opting out by any of the county mayors, and really leave it up to the ledge to set the policy. What are your thoughts on that, given that you've been leading the safe travels efforts from the beginning?
Well, I think I'd have to understand better what he means by running it. So obviously the administration, as all administrations have to, will be running the program, because the legislature is only in legislative session from January 18th till about May 1st. But I do agree with Scott, with Speaker Psyche, that we should have a uniform policy. I've maintained that position from the beginning. I think it makes a lot more sense, even if we have to compromise and be a little bit more conservative to meet people halfway somehow. I think one operational approach to the Safe Travels program will make it easier for people to understand from the mainland. It's got to be simplified, because a simplified program will mean better participation and people will not try to get around the system. You can't really have the legislature make small changes incrementally after the session ends, because they can't come in for special session constantly to update a program. That's why you have an executive administration. But I would love to see uniform rules, and I've spoken with the speaker about this kind of thing, and I do support that. The more input that we can have to make it simple, the better. I will say, though, that the Safe Travels program has been a significant success. We will touch our 1 millionth traveler in the Safe Travels program into Hawaii sometime in the next 96 hours, and we've not seen extra spread from travel cases. So that is working, but there has been a lot of consternation, as Speaker has talked about people getting confused about the rules on Kauai versus the rest of the state. And that kind of thing makes it difficult for us to really police. So I think that's what he's getting at. But I'm looking forward to the legislative session. I work very closely with my old colleagues.
On that safe travel program and some of the changes that were made, the most recent major change was having the test results in hand before boarding a plane and arriving here, rather than getting here and not necessarily having the test. Since that change, have we seen a reduction in the number of those visitors who have tested positive after arriving here to the state, knowing that a lot of them have already gotten those tests before? With that change, has that sort of impacted our results that we're seeing in terms of positive cases?
I don't think significantly. The trick here, of course, is you just sometimes don't know if someone doesn't have their test. They might just walk away from the airport, or if they had a positive test, they could just pretend as if they didn't and still travel. We get all kinds of variations on this theme. We have had, I believe it was, someone told me, 9 cases in the last 4 or 5 days that arrived, and we were already informed that the individuals were positive, and they likely knew it. It's a problem. It's a very small number overall as you compare to, today was 172 cases, and just 4 days ago we were at 264, and the day before that 322, right? So these are overall very small numbers. The focus should be on community spread. I do think that there can be a better policy overall as far as travel goes if you want to tweak the rules a little bit, but changes create chaos. And if you just have people get, for instance, tested out of quarantine when they arrive, no one will get tested beforehand. They'll bail on that, and that could create a lot of problems. So it's a pretty complicated question. Right now, the Gov has decided to stick pretty closely with you must have your test in hand, and you have to get tested within 72 hours. And we're getting about an average of, say, 11,000 travelers per day, of which 3,000 tend to be our own returning residents, seeing their loved ones. We're getting through okay. In the wintertime, when we normally see more travelers, come February, March, I think they're going to want to kind of streamline this process. That's why I really want to focus on, if people have been vaccinated, that it's okay for them to travel and to get the exemption.
We know that you have that call with the county mayor soon. I want to go to Dave Hall's question, Ryan. This one's at 10:40. He says, when do you expect we can get back together with friends and family at special events like birthdays and graduation? This is kind of a big picture question, not necessarily returning to life as normal, but when can we start to have these social gatherings? What's the timeline for something like that? I know it's hard to anticipate, but Dave and so many of us just want to see our friends again.
Yes. So I do think that the mayor will opine on that soon as to whether he will allow larger gatherings. We're going to come out of this 2-week period that I called for in about 10 days, and our numbers should be significantly lower. Special events, birthdays, graduations, come May, June, many, if not all of us who wanted to get a vaccine will have gotten one. And that's going to make it very easy to get back to normal. Very easy. I think that the mayors will probably lean pretty heavily on our overall vaccination status as to big gatherings and big events. It'll get better each month is all I can really tell you. Each month that passes, we'll have less vulnerability for first our kupuna and our healthcare community than people who are 65 and older and those who have chronic disease. And all of those individuals will have far less fear about getting together and far less risk. I would still recommend people wear masks if they're going to gather even once vaccinated, because we don't know for sure that they can't spread from their own upper airways two other people that are visiting with them, even if they're younger. And we don't want massive spread. We're also going to have our schools and our school teachers vaccinated in the next like 6 to 8 weeks. Another big safe thing so that school gatherings are way less risky. So each month incrementally, and I know it feels like it goes slowly, but each month incrementally, we're going to be that much safer from the vaccine. So by mid-year, come 4th of July, I expect us to be in a very good spot statewide. Some groups will be there a little sooner, some groups a little later, but it won't be all year. And that's a big blessing because I know people need to get back out into their regular lives. And the social interaction is the largest sacrifice that people have made.
All right, Lieutenant Governor, our time here is wrapping up, but we do just want to allow you an opportunity to have a final statement, anything that you want to say. We know that you had mentioned earlier in the broadcast, for those who are just tuning in, that an announcement is expected later this week about sort of the rollout and the further rollout of the vaccine program. But any other final words and thoughts that you have regarding what's happening here in the state?
Sure. Thank you for that, Ryan. So I would expect a week from today, next Monday, we'll be able to significantly ramp up vaccines here, especially on Oahu, over at some larger centers, Pier 2, run by HPH, followed very likely a week later, Queens over at the Blaisdell. We are already doing thousands and thousands of people each week in smaller pods, and so that's really been going quite well as compared to other states. I just ask people, we are 4 days into my request, and it's a humble one, I hope, to not have social gatherings until a week from Friday. Please do that because that will get our numbers more under control. If we can continue to be safe together, this commitment will result in a much easier winter as we vaccinate the rest of our population. So watch out for major announcements this Friday. We will be using lots of different mediums to express the information, and it should be a simple, straightforward sign up and large sites here on Oahu, plus a lot of sites dotted around the neighbor islands in partnership with health centers and hospitals. But I appreciate everybody's patience, and we've done a good job, better than any other state in the country, keeping cases low. They're not at zero, but they're lower, and we should be proud of that.
Lastly, before you go, a lot of people are asking where they can sign up. Can you give us that website, if you would?
Yes, so the sign up place to click is not there for them yet, but it will be at hawaiicovid19.com. We expect to do it through our main website, hawaiicovid19.com. As soon as they finalize the details on that Monday start, we expect to have that readily available. And one of the reasons that we get that to people this week is because they'll be starting up. We'll also be able to have information about whether there's going to be any walk-in capacity or not, that kind of thing. I will give more updates on social media. It's at LTGov Josh Green. If people want to do that, I'll try to do them on Wednesday, Thursday, Friday if we have any breaking news. But I think there will be a press conference on Friday afternoon for everybody to see exactly where they can go and when.
All right, Lieutenant Governor Josh Green joining us this Monday morning. Thanks so much for the update and all the information, and of course for taking questions from our viewers. We really appreciate it.
And if I may, one last thing. Happy birthday to my 14-year-old Maya. Love you, Maya.
Oh, happy birthday.
Happy birthday, Maya. Thank you so much, Lieutenant Governor. We appreciate it. Well, good to hear from him, and some interesting and exciting news, this idea of having mass sites that are just dedicated to vaccinations. He said the Blaisdell and Pier 2 with Hawaii Pacific Health, and the Queens Medical Center taking on the Blaisdell. That will obviously allow access for thousands of people to get vaccines, as opposed to having to, inundate primary care provider offices. This is just a very streamlined approach. That website, the sign up, not quite available yet, but he did indicate that by the end of this week, we will have more information about how to sign up to get one of the vaccinations at one of those big sites.
And, he also spoke about those numbers that we're seeing, those case numbers in terms of those positivity numbers through the tests that have been coming through. He's saying those numbers seemingly going down, thankfully. Of course, we saw those big numbers with 300 cases last week. Today, he said that something I think was 174, I believe is what he said, was today's number. And so he believes that this surge that we're seeing in numbers, of course, directly resulting from those gatherings that happened over the holiday weekends, and believing that those numbers will continue to go down as we move forward. And we heard that he put out that request and that call to the community to avoid any sort of social gatherings for the next 2 weeks. And he's hoping that people are actually listening to that, and that will help to kind of allow those numbers to move down.
Absolutely. The vaccine sort of slowly trickling into the state, but he did say that they're hoping that 2 more vaccine companies will be approved, and that could increase the amount of vaccine available to up to 300,000 per month. And he also said, when we asked that sort of big picture question from Dave, that I really like that question, sort of when can we get back to normal? He's really anticipating, and he said it before, around Independence Day, that by July 4th, things will look very different, because sometime in May or June, everyone who's wanted a vaccine, if the schedule continues, will have gotten one.
Yeah, we'll continue to keep you posted on that, and hopefully we will be able to once again get back to a little more sense of normalcy in the middle of this month. We continue on in this year. We continue on in these conversations. We'll be sort of switching gears a little on Wednesday as we speak to Congressman Ed Case, who will be joining us here on Spotlight Hawaii. We, of course, will be speaking to him of all the events that are happening right now in Washington, D.C., the calls for the impeachment, the articles of impeachment that have been filed within the House of Representatives. Of course, he is a part of that. We will get his take on that, as well as the CARES Act funding that is also going to be coming down the pipeline. So a lot to be talked about and to get an update on coming from Washington, D.C.
Yeah, we look forward to that conversation. And I saw some questions, as we get basically every time we come on, about unemployment benefits. We do have the head of the Department of Labor and Industrial Relations, Ann Pereira-Estaquio, joining us again on Friday. She's been kind enough to join us at least once a month on this program. So we're going to dive deep into what benefits are available. There is that $300 plus up that has now been approved and should be trickling into bank accounts, supposedly right now. So what do you have to do to qualify? How do you sign up? What if you are stuck in that limbo? We're going to talk to her about all of that. So if you or anyone you know is eligible for unemployment benefits or has been having any trouble with that system, as we know so many people have, please do join us on Friday at 10:30. But as Ryan mentioned, Congressman Ed Case on Wednesday. We really look forward to getting an update from Washington.
And we look forward to seeing all of you here as well. We encourage you to be a part of the conversation. Share this show and this video that is posted again on the platforms of the Honolulu Star-Advertiser. And definitely make sure that you continue to comment and ask your questions. We love to engage with as many of you as possible through our shows. We thank you for watching. We'll see you right back here on Wednesday at 10:30. Aloha.
Aloha.